So, welcome to this very first FCM2 lecture. Now, here we will be touching on the basics of epidemiology. To facilitate better understanding of the concepts that will be discussed herein, I strongly urge you to review on some topics you've covered in Medical Research 1, particularly those on basic study designs. Now, just a preamble before I continue. Now, take note that the topic Introduction to Epidemiology is the first lecture for the first module, which is on the general concepts of epidemiology and preventive medicine. Now, clearly, the topics included here are very timely given our current pandemic situation. Now, I will also be delivering the topic of disease causation to you, so that'll be the second video series. Now, finally, Dr. Mark Bessa will be delivering the topics of epidemics and disease prevention to you. Now, he'll be going into more detail as to how epidemics are investigated. Now, at the end of this basic epidemiology lecture series, you should be able to define epidemiology and describe its characteristic features, discuss the main types of epidemiologic studies, describe the different levels of disease occurrence in a population, and finally, discuss methods used to describe disease occurrence. Now, this will be the outline of the entire Introduction to Epidemiology lecture series. So, there will be 3 video lectures all in all for this topic. Now, this particular video will be focusing on the characteristic features of epidemiology. Now, this introduces to you what epidemiology is really all about. I've used quite a number of references to put together this video lecture series. The main reference that we've prescribed for this topic, however, is the latest edition of Basic Epidemiology by Bonita, Beaglehole, and Shellstrom, particularly the first chapter. Now, this edition is still from 2006, but the concepts presented are still very much applicable to this date. Now, to complement the current times, I have provided separate material on the epidemiology of the novel coronavirus. Now, take note that this is required reading, because you'll be using that to answer problem set questions which I have uploaded in the Module 1 folder in Red Canvas. Now, the word epidemiology is derived from the Greek words epi, or upon, demos, or people, and logos, or study. Now, as the etymology implies, those involving themselves in epidemiology are interested in looking for factors that would help explain to them certain phenomena occurring in the population at large. So, to put this definition more into context, we elaborate by saying that epidemiology is a study of the frequency, distribution, and determinants of disease, as well as health-related states and events in a particular population of interest. Now, the epidemiologist takes all of this information and applies it so that disease can be prevented, controlled, and mitigated. Now, let's take this current pandemic situation. We already have daily data on frequency and distribution that is presented to us by the DOH, and with the current knowledge that we have acquired so far about this novel coronavirus, we know now that the elderly and those with comorbidities are particularly at risk for developing severe COVID-19 disease. Now, we also know that the spread of the virus can be prevented if we stay indoors at home as much as possible and prevent any unnecessary travel. And if there's a need to do so, always wear masks and face shields when outdoors. Avoid crowding as much as possible. Observe proper hand hygiene. Observe adequate physical distancing. And if ever someone develops symptoms, advise them to seek medical consultation from a physician the soonest time possible. Now, let's have a look at the other elements of the definition. Epidemiology deals with health of groups or populations, not individuals. And this is really what public health is all about. Public health referring to the collective actions to improve population health. And such actions include determining the etiologies of disease as well as preventive methods. Notice that we use the term specific population. In epidemiology, we have to define specifically what the group of interest is, and this is frequently in terms of their geographical, occupational, and other pertinent characteristics, depending on the public health concern being investigated. The distribution of disease in the population is also of utmost interest in epidemiology. And by this distribution, it means we want to know its occurrence in terms of person, place, and time. And take note as well that disease is not the only health-related state that offers itself to investigation. Now, depending on the situation, other health-related states would be measured. And finally, epidemiologists need to know if there are certain factors in a particular population that puts them at a higher chance of developing a change in health state. Very often, we call these determinants risk factors. What is a risk factor anyway? According to Last, in the Dictionary of Epidemiology he authored, see references at the end of the video, a risk factor is an aspect of personal behavior or lifestyle, environmental exposure, inborn or inherited characteristic, which, on the basis of epidemiological evidence, is known to be associated with a health-related condition, considered important to prevent. Now note the keywords that are color-coded. Basically, the amount of risk a particular individual has to developing a particular medical condition could be genetic, something he or she has no control over. The environment he or she is in can also be a risk factor. Let's say someone is living in an area with high particulate matter content in the air. That can put that person at risk for certain chronic respiratory diseases. Now, risk factors can also be modifiable, meaning the person has control over it, and this involves their behavior or lifestyle. And when we say modifiable, such behavior or lifestyle can be changed for the better. That is, changed in order to prevent occurrence of disease. Now, let's explore a little bit of history and epidemiology. Now, way back in 400 BCE, Hippocrates has already considered the environment as a factor in development of certain diseases. It wasn't until 2 millennia later that quantitative methods were used when dealing with health-related data. Per historical records, John Grant, an English statistician, spearheaded this practice. It was still quite simple back then, involving the presentation of count data in tabular form only. Nonetheless, Grant laid the foundations for modern demography. Now, analytical use of data wasn't until 2 centuries later. By taking a closer look at the distribution of cholera cases during the 1854 London cholera outbreak, as well as looking at the characteristics these cases had compared to non-cases, an English physician by the name of John Snow was able to determine that the etiology of cholera was actually bacteria in the water, and not because of something airborne. This marked the formal beginnings of the field of epidemiology, alluding to its definition earlier in this video. Now, by mapping the cholera-related deaths that occurred, John Snow was able to zero in on a particular water pump along Broad Street. Apparently, these cholera-related deaths would regularly get their water from said water pump. Now, by doing further investigation, Dr. Snow found that the cholera cases were high in areas of London supplied by 2 waterworks companies, namely Southwark and Vauxhall and Lambeth. Now, these 2 companies sourced their water from the polluted part of the Thames River. Now, using census data from 1851 and the number of cholera-related deaths observed in the 2 respective areas subserved by these 2 companies, Dr. Snow was able to compute the respective death rates per thousand population. Now, clearly, areas whose water was supplied by the Southwark and Vauxhall Company had a conspicuously higher rate of cholera-related deaths. Now, on further digging, it was found that 2 years prior to the outbreak, the Lambeth Company relocated its water source to less polluted areas of the River Thames, which would explain the lower death rate in the areas this water company supplies. Now, of course, satirical illustrations as the one on the left came out when Dr. Snow's report was made known. Now, this offending water pump no longer exists. The one along modern-day Broad Street, now called Broadwick Street, in London, that you see in the photo on the right, is just a replica of that famous offending pump. Notice that it has no handle, symbolizing the removal action taken by local officials to halt the cholera outbreak at the request of Dr. John Snow. Now, another interesting finding Dr. Snow encountered during his investigation was that none of the workers in the nearby Broad Street Brewery contracted cholera. Now, these workers did not consume water from the offending water pump because they were given a daily allowance of beer. And of course, they would rather drink that. So, apparently, during the brewing process, the unfermented beer is boiled, and this killed the Vibrio cholerae bacteria in the water they had used to brew with. Of course, non-communicable diseases that arise from chronic beer drinking opens another can of worms, and we're not going to cover that in this video lecture series. Now, around the same time as the cholera outbreak, this time in Austria, physician Ignaz Semmelweis began the practice of meticulous hand washing prior to handling his obstetric patients. Now, this practice was found to lower significantly the incidence of puerperal fever or childbed fever, which was apparently common in many mid-19th century hospitals in Vienna and was often fatal. Now, fast forward 100 years, the landmark Framingham Heart Study was launched. Now, this is a long-term and actually ongoing cardiovascular cohort study of residents in the city of Framingham in the state of Massachusetts in the United States. It was started in 1948 and it included 5,209 participants between the ages of 30 and 60. At present, this study is already on its fourth generation of participants. So we owe much of what we currently know about factors associated with cardiovascular disease or coronary artery disease, such as diet, exercise, blood pressure, cholesterol levels, cigarette smoking, intake of aspirin, on this particular study. You will definitely be going back to this in internal medicine in your future years as well as in your clinical years. Now, also around the same time period, in Britain, Sir Richard Dall and Sir Richard Peyto of the Oxford University embarked on a longitudinal study that aimed to investigate if an association exists between lung cancer and smoking. Now, strangely enough, during that time, when not much was yet known about the harmful long-term effects of smoking, advertisements such as this was quite commonplace, with matching endorsements from physicians even. Now, going back to this study, Dall and Peyto enrolled almost 34,500 British doctors and surveyed them about their smoking habits. They followed them as well over the course of 20 years. Now, this study was monumental because it uncovered a dose-response relationship between the amount of smoking and lung cancer. Now, this dose-response relationship basically states that the more one smoked, the higher the risk for developing lung cancer. And they were able to construct a linear model of this relationship. But of course, they had to mention certain caveats to it, like random error or systematic bias. Now, had the methods for calculating and interpreting measures of association been available to the researchers back then, they would have reported a relative risk of 14 in cigarette smokers compared with never smokers. That is, the incidence of lung cancer is 14 times more among smokers than never smokers. And this measure of association is too high to be dismissed as being biased. And so this graph shows that said dose-response relationship. Now, basing on the data gathered by Dall and Peyto, there is a positive linear relationship between the average number of cigarettes smoked per day and the annual lung cancer death rates per thousand population, that population being British male doctors. Now, an interesting finding in the Dall and Peyto study was that some non-smokers developed lung cancer, while some heavy smokers remained cancer-free. Now, this opened the possibility that there may be a number of other factors besides smoking, such as asbestos exposure, that can contribute to development of lung cancer, something that is covered by the theory of multiple causation. Now, similarly, this also opened the discussion that some of these factors are essential to the development of lung cancer, while some merely increase the risk of its development. Now, we will be covering the theory of multiple causation and the sufficient component cause model in the disease causation video series. So, in a nutshell, the overall goal of epidemiology is to identify risk factors of a disease and prevent said disease by controlling or doing something about the risk factors that are modifiable. Well, this is a rather simplistic way of looking at the goals of epidemiology. Now, it is also important to mention that the use of epidemiology can be extended to and applied to a wide range of problems, from transmission of an infectious disease agent to the design of a new strategy for healthcare delivery. It is also important to stress that epidemiology is not a static discipline. It continually changes as it is adapted to a greater range of health problems. And this change involves adapting or borrowing techniques such as mathematics and statistics, which is often used for modeling and prediction. Now, let me close this video by mentioning that epidemiology is an integral part of public health. And going back to what I said earlier, public health encompasses the collective actions that aim to improve population health. Epidemiology aims to establish causation of disease. But mind you, this is very difficult to do, and there are many conditions that have to be satisfied first before something is said or considered to be causative of a disease. More frequently, risk factors are identified. And as you will learn eventually under disease causation, identifying the exact cause of disease perhaps may not really be necessary, since the disease itself can be prevented or mitigated by addressing the risk factors alone. Now, epidemiology finds use as well in terms of describing the natural history of disease. A very good example is with the novel coronavirus. Now, by taking care of COVID-19 patients, physicians were able to describe the different stages of COVID-19. Now, epidemiology is likewise often used to describe the health status of a population. By knowing what the burden of disease is, limited resources can be allotted prudently in such a way that the best possible effect can be obtained. And lastly, epidemiology is used to evaluate how well a public health intervention, or any medical intervention for that matter, has performed in terms of restoring health, preventing disability, and improving quality of life.